is that if you look at the spending on health in Nigeria, we're not spending enough for the population, and there are many comparators. But for every, let's say, 1,000 naira that we spend, total health expenditure, about 100 naira will come from external parties, about 300 naira will come from all levels of government, and 60 naira is coming from private sources, households, and out of pocket. So the external component of our total health spend is less than 10%, it's 10% or less of the total spending on health.
My dear Coordinating Minister, we have always argued for increased domestic funding and less dependence on foreign funding for our health system, and as we are all aware of the withdrawal of financial support by the U.S. government funding for African health system, the Nigerian government has equally risen to the occasion by allocating more resources to the fight against communicable diseases such as HIV, tuberculosis, malaria, immunization, and so on and so forth. Thus, making the decision of the U.S. government to appear as if it's a blessing in disguise.
Despite the abrupt nature of it, I think Nigerians can be rest assured that government is doing all that it can within its limited resources to ensure that we provide for the treatment of our population this year and also in the years to come, in terms of buying the commodities, bringing them in and distributing them. It may not be the same level as those who were bringing it through the external parties who are doing it. They were bringing those resources from paying in US dollars. We have Naira. So we have to calibrate the expectation, but President Tinubu and his administration are doing everything possible to ensure that we protect the health and well-being of Nigerians.